Good evening, everybody. I'm Dr. Carrie Riestenberg from Coastal Fertility, and I'm excited tonight to talk to you about fertility preservation and egg freezing for our Coastal Quickie educational series. So I do have Holly here with me. She's going to be fielding questions. So if you do have any questions, please feel free to enter those into the chat, and then we will go ahead and answer those at the end of the talk. And don't worry, we'll make sure to get to all those. So tonight's overall topic is fertility preservation, and I wanted to just briefly go over the different options for fertility preservation. So those include egg freezing, and that's what we're going to spend the majority of our time talking about tonight. But in addition to egg freezing, other options for fertility preservation include embryo freezing, ovarian tissue cryopreservation, and sperm freezing. So reasons we might pursue embryo cryopreservation or embryo freezing rather than egg freezing would be if you have a sperm source that has been selected, so either a single female using donor sperm or a couple who wants to delay fertility until later, they might do embryo freezing. Ovarian tissue cryopreservation is a technique that has been recently removed from the experimental list that is actually used for prepubertal girls who may need to preserve their fertility prior to chemotherapy or radiation or surgery that would compromise their ability to have children in the future. And then finally, sperm freezing is an option for male patients who may be undergoing gonadotoxic treatment like chemotherapy or radiation who want to preserve their options for fertility in the future. But as I said, the majority of what we're going to be talking tonight about is egg freezing. So just to start off with, what are some reasons we might consider freezing eggs for fertility preservation? The most common reason would be delaying childbearing either for social or personal reasons. Other reasons include doing egg freezing prior to chemotherapy or radiation or other treatment that would compromise egg quantity or quality, such as surgery on the ovaries or treatment, other surgeries that might compromise the ovarian reserve. Additionally, some patients who are at increased risk of premature ovarian failure, for example, patients with chromosomal abnormalities such as Turner syndrome or Fragile X syndrome, or just with patients who have a family history of early menopause, might consider fertility preservation with egg freezing. And finally, we do a lot of egg freezing for egg donation as well. So the largest proportion of our patients who pursue egg freezing for fertility preservation do so for personal or social reasons to delay childbearing, and we can see why that is. The U.S. Census Bureau actually just recently reported that there is the average age of childbearing has just reached its maximum at 30 years old in 2019, and that's the most up-to-date data. So we can see that women are really delaying childbearing these days, and so this is a great option to kind of keep your options for fertility open for the future. So what is the point? Why do we do fertility preservation? Let's talk a little bit about female fertility, and that will kind of inform why this really is a procedure that a lot of people might consider. So as many of you know, female fertility declines with age. We know based on large population studies that per month pregnancy rates or fecundity decreases from your early 20s into your 30s, and then the rate of decline starts to increase at 35 and then really goes down significantly after the age of 40 really. So that is really due to a decline in the egg quality as well as the egg quantity. So first, to talk about egg quantity. Women are born with all the eggs they're ever going to have. We actually have the maximum number of eggs when we aren't even born yet. So when we're about 16 to 18 weeks along in our mom's bellies, we have about 6 to 7 million eggs, and that's our maximum number of eggs that will ever be in our ovaries. That number of eggs actually declines, and at birth it's about 1 to 2 million. By puberty, we have generally about 300,000 eggs remaining. By age 40, we have 25,000 eggs remaining, and then by the average age of menopause in the US, which is 51 years old, we have about 1,000 eggs remaining. So you can see that we do lose eggs throughout our lives, whether we're on birth control pills, whether we're not on birth control pills, whether we're pregnant, not pregnant. Each month we're losing eggs, and that's part of what affects our fertility as we get older. But actually, more important than even the quantity of eggs is the quality of eggs. So what do we really mean by egg quality? Egg quality really refers to the proportion of eggs that are chromosomally balanced. So you and I and all of us on this chat here, we all have 46 chromosomes in every cell of our body. We got 23 chromosomes from our mom in the egg and 23 from our dad in the sperm, and when they combined, they made the 46 that is us. So in order to be a healthy human being, you have to have 46 chromosomes. That's the genetic material that tells your body how to be a healthy, normal human. So for the egg to create a healthy pregnancy, it has to have exactly 23 chromosomes, no more, no less. Otherwise, it results in either not getting pregnant, or getting pregnant and having an early miscarriage, or in less common situations, chromosomal abnormalities like Down syndrome. So the proportion of our eggs that have the exact balance of 23 chromosomes decreases over our lifespan because the eggs have been sitting around in our bodies our whole lives. To illustrate this point, just for ballpark numbers, at 30 years old, roughly 70% of the eggs are chromosomally balanced with 23 chromosomes. By the time we're 35, it's more like 50-50. And by the time we reach 40 years old, the ratio has reversed, and actually only 30% of the eggs are chromosomally balanced, and 70% are chromosomally unbalanced. And so you can see that if, let's say at 40 years old, only 30% of the eggs are chromosomally balanced, that means only every 3 to 4 months are you likely even releasing an egg that has the capability of turning into a pregnancy. So that is really the critical factor that impacts our female fertility as we age, and that's why we really can take advantage of egg freezing technology to freeze our eggs at the current age that we're at, with the current number that are present and the quality that are present at that age. So that's really kind of the why behind why we consider egg freezing. Okay, so let's talk a little bit more about the history of egg freezing. So the first human pregnancy from a previously frozen egg was actually reported in 1986, which I was blown away by when I heard that. That's a long, many years ago in terms of our field, because our field is really relatively young. So, over 35 years ago was the first human pregnancy from a previously frozen egg. A lot has happened since that time. And the American Society for Reproductive Medicine actually removed egg freezing from the list of experimental treatments in 2013. And since that time, there have been huge advances in the field, and it's really become popularized, and many more people are pursuing egg freezing these days than were even 5 or 10 years ago. The major change that has occurred in the field that has improved the quality of this technology is something called fast freezing or quick freezing, also called vitrification. So years ago, over 20 years ago, a technology called slow freezing was much more commonly used, and as the name suggests, that involved freezing the eggs at a slower pace. Unfortunately, when you freeze eggs at a slower pace, because the egg is a single cell and it has a large water content, the water inside the cell tends to crystallize, and then when you come back to thaw the eggs don't have as good of a chance of surviving. So the quick vitrification freezing technique has become, really is the primary technique used these days, and it has really made egg freezing just as viable as embryo freezing, which has really changed the game for patients who don't either have a partner or don't know where the sperm source is going to be coming from. So these days with egg freezing, we generally report a rate of egg survival of the thaw of about 90%. So most clinics see about 90% of their eggs surviving the thaw when patients come back to use them in the future, and that's a huge improvement from historical data. Okay. So next, most patients want to know kind of what is this process of egg freezing? How long does it take? What can I expect? So the egg freezing process takes roughly 1 month from start to finish. The whole process generally starts with the start of the menstrual cycle. You typically call your nurse with the first day of bleeding, and then we generally, with the most common protocol, which is called the antagonist protocol, we put you on birth control pills for about 2 weeks. Now, this isn't for all patients, and certainly there are circumstances in which we would use other approaches, but most commonly we use birth control pills for 2 weeks. That seems a little counterintuitive, right? Why are we putting you on birth control pills when we're trying to retrieve eggs? So the way I describe it is that we want to kind of bring all the eggs in the ovaries behind the starting line. So to back up, in your natural cycle, if you're not on birth control pills and you're ovulating, what happens is a group of eggs is released from your invisible warehouse that has those hundreds of thousands or tens of thousands of eggs. Let's say 10 are released. Out of those 10 eggs, one is selected to become the dominant egg. That follicle, which is the fluid pocket that contains the egg, grows large in that cycle and eventually bursts open, releasing the egg and gives you an opportunity for fertilization, and the other 9 die. So in egg freezing, we don't want just one egg to grow out ahead of the rest. We want them all to grow together. So we start off by bringing them all behind the starting line by putting you on birth control pills for 2 weeks. So that's the purpose of the pills. It does a gentle suppression of all the eggs to bring them all behind the starting line. After 2 weeks on the birth control pills, we have you stop the birth control and then you start your injection medications. Those are the stimulation medications that are actually the same as the hormones that your brain makes naturally to get the ovaries to grow a follicle each month, but we just give them to you at higher doses. So that instead of only growing one egg, we want you to grow as many as safely possible. So you take those stimulation medications every night or every day for generally about 9 to 12 days. And it's during that period of time that you want a little flexibility with your work schedule because you'll be in the office with us about every other day for ultrasound and blood work. What we're doing with those ultrasounds, and those are transvaginal pelvic ultrasounds, we're monitoring as those follicles grow in your ovaries, and we're monitoring the follicle size as well as your estrogen level in your blood, and we monitor that really closely so that we can make any medication changes or modifications in order to get an optimal outcome for you. At the end of that 9 to 12 days of the injection medications, we give you a final trigger injection. That trigger results in the final maturation of the eggs, so it gets them ready to be retrieved. And about 35 to 36 hours after that final trigger injection is when your egg retrieval procedure will be performed. That procedure is a same-day surgery. It's done under IV anesthesia, so you're fully sedated and comfortable, but breathing on your own. It's very gentle anesthesia. We say you get a well-deserved nap. It's generally only about 15 to 20 minutes, and it's all performed transvaginally, so you have no incisions, and you need a driver that day. So that's the one thing. Most people can go back to work the following day, so there's really no downtime. And that's about it. That's about the conclusion of your egg freezing process. While you're in surgery, we will be getting real-time feedback from the embryologist about how many eggs are being retrieved. We hand off the little fluid vials through a hole in the wall to our embryology lab. The embryologist looks under the microscope and finds all the eggs. And so before you go home that day, we'll actually be able to tell you how many eggs were retrieved that day. Later that day, the embryologists clean off the helper cells off the outside of the eggs, and they're able to tell how many of those eggs are mature. This is really important because only mature eggs are capable of being fertilized in the future. So we only freeze mature eggs. Now, on average, of the eggs retrieved, generally about 75% are mature. So the following day, the day after your egg retrieval, you get a call from the embryologist and they tell you how many eggs can ultimately be frozen for you. So that's the end of the egg freezing cycle. In terms of what to expect during the stimulation, many people are really concerned that they might have severe mood swings or feel really unwell, but honestly, the vast majority of people feel really good. Your estrogen level is high, people feel really generally good, and the most common side effects are fatigue and abdominal bloating, which all go away pretty quickly after the egg retrieval. So most people tolerate it very well. And overall, the risks of this kind of a procedure and the stimulation are, generally less than 1% risk with the surgery. It's as kind of as low risk surgery as you can get. So, next, oftentimes patients really want to know, well, what does it mean to have eggs frozen? How many eggs do I want to freeze? And what is the optimal age to freeze eggs? These are the most common questions I'd say we get after we talk about all this. And the answer, isn't that straightforward. It's very dependent on the individual patient, their family building goals, and kind of, their personal situation as well as their health circumstances and health history. But I will say that in general, each egg has kind of a fertility potential of about 4 to 12%. So what I mean by that is there's about a 4 to 12% chance per egg that could result in a pregnancy. That's a little bit hard to conceptualize, but there are different tools that we can refer to and that we'll show you during your consultation that are available online. Brigham and Women's Health has a really nice calculator that if you Google online BWH for Brigham and Women's Health, egg freezing counseling tool, that'll take you to a nice tool online where you can put in your age and the number of eggs frozen, and it'll give you a probability of at least 1 live birth or at least 2 live births based on the number of eggs that you have frozen. So there are different tools available to kind of give you an estimate for the fertility potential for the future. Now, these are just calculators. They are not perfect, and each individual patient is very different. Some patients overperform expectations, some patients underperform, and that kind of brings me to another critical point. So I certainly have a lot of patients who come to my office and say, I want to freeze my eggs so that, it's an insurance policy for the future. And I really encourage people to not consider it quite in that way. And the reason I say that is, every month, let's say you pay for your car insurance or your home insurance every single month, right? And if something happens, you call your car company, you call Geico or AAA or Farmers, and you say, I was in an accident, and they come through. They pay for the repairs. Egg freezing is more of an investment in your fertility for the future, but it's not a guarantee, unfortunately. I wish I could say that it was, but it is the best investment that you can make in your future. We just never really get to 100% chance of a future pregnancy. Okay, and then to come back to the second portion of that question, so what is the best age to consider egg freezing? There have been a lot of studies trying to answer this question, and again, there isn't really one optimal age. Again, it really does depend. Do you want 1 child? Do you want 2? Do you want 4? Are you 30? Are you 35? Are you 39? But what the majority of the studies show is that the best chance of success with egg freezing is when you pursue it in your early to mid 30s, kind of before the age effects on the quantity and quality of the eggs becomes really substantial. You're going to have a higher likelihood of getting a good number of good quality eggs that are going to give you the best chance for pregnancy in the future and keeping your pregnancy options open for the future. So that's generally how I advise my patients. Let's see here. I think those are the most important things that I wanted to review. I would say after an egg freezing cycle, it's always very important to touch base with your doctor, and that's the point to have that discussion. How many eggs did I freeze? What does this mean for my future fertility? Am I comfortable with that, or do I want to potentially consider another cycle? So it's always really important to circle back with your doctor after completing your cycle to say, am I comfortable with where I am, or do we want to potentially talk about, considering another cycle in the future? And then I think just to close, many patients feel that egg freezing really can be another benefit to it is that it can really kind of relieve a certain amount of pressure that a lot of people feel when they are not in a relationship. So it's really is generally a very good investment in your future, and something at least to come in and get the information about. So if you're considering it, I highly encourage you to schedule a consultation, come in, have a fertility evaluation, talk with your doctor, so at least you can make the best decision for you. That's really my goal for my patients is, not every patient that I see, considering egg freezing is, really the right candidate, but at least you have the information and can make the best decision for you to increase the chances of being able to complete the family that you desire down the road. So at that point, I think I will go ahead and see if we have any questions and answer those at this time.
We don't have any questions
Okay.
right now.
All right, let me see if I have anything else here that I wanted to cover. Let's see here. Okay, so I think let's go into just a tiny bit more detail before we wrap up for the night. So I kind of explained that each egg that we retrieve and freeze has a 4 to 12% kind of fertility potential for the future, and that sounds very low. So let me kind of explain a little bit behind why that is. So when you come back in the future to use your frozen eggs, we talked about the survival of the thaw being about 90%. So if we're starting off with 10 eggs, maybe 9 survive the thaw. Of those 9, we then combine them with the sperm generally through a process called intracytoplasmic sperm injection, or ICSI. That's the way that we fertilize previously frozen eggs. So we take the egg and we take one healthy looking sperm and actually inject it directly into the egg. Of those eggs that we perform ICSI on, about 75% successfully fertilize. And then from those fertilized eggs, we generally will grow them in the lab for approximately 5 or 6 days. And about 50%, 30 to 50% of the fertilized eggs make it to that day 5 or day 6 embryo stage called a blastocyst. So you can see that there is a little bit of attrition at every step. And then not every embryo that we create will result in a pregnancy. So that's really why we, need to start out, ideally start out with a higher number of eggs in order to give you a good chance of at least, one live birth or one pregnancy. And then I think the only other piece of information patients will ask, are there concerns about, pregnancies or babies born from previously frozen eggs? There have been studies looking at children born through previously frozen eggs versus children born through eggs that were retrieved through IVF and then fresh, fertilized in the fresh state and transferred fresh. So never frozen, but that were kind of born through IVF. And there haven't been any differences in chromosomal abnormalities or birth defects seen between these two children cohorts. So overall, extremely reassuring data, although, this is, again, as I said, a relatively new technology. So those studies are definitely ongoing.
One thing I think we could talk about is the financial aspect of it. Do
Sure.
you have an idea of what that is?
Yeah. So big question. After we finish our conversation, our consultation, the next question my patients always have for me is, well, what's this going to cost, right? And unfortunately, cost is a huge part of the discussion and a huge part of what we do. Fortunately, a lot more insurances are covering these treatments these days, which is fantastic. And we at Coastal do take all insurances. So, we will maximize any benefits or coverage that you have. I can see that there. We have a question about the cost. So, at our clinic, it's generally in the range of $7,000 for an egg freezing cycle. But again, many patients are having a lot more coverage for these treatments these days. And so when you come in for your initial consultation, you'll meet with myself or one of our physicians. You'll then meet with your nurse. And finally, you'll meet with one of our financial counselors. And they go into a detailed discussion with you about any fertility coverage or benefits that you have through your insurance and then what the cost would look like based on that. So, but certainly that's a big part of the consideration.
One more question I have is, you may have already said this, but what is the age range for the best quality of eggs to freeze?
Yeah, it's a great question. So what is the age range for the best quality of eggs to freeze? Certainly, the younger we are, the better quality that our eggs are. But, if I recommended egg freezing to everyone at 20 years old, the vast majority of patients wouldn't come back to need their eggs in the future. So it's kind of finding that sweet spot where you're going to have a good chance of having success, you know, when you come back to use those eggs in the future, but also a higher chance that you might need to use those eggs in the future, if not for baby number one, maybe for baby number two. So generally, you know, I would generally recommend to consider this in the early to mid 30s. And if you kind of are reaching 35 and aren't considering starting your family soon, then that's a really good time to kind of consider this and come in for a consultation.
That's good.
Yeah.
I think we're good.
Okay, wonderful. Well, it was really nice connecting with you online tonight. Fertility preservation and egg freezing is one of my favorite topics, so happy to kind of have the opportunity to discuss this with you all. We hope to see you at Coastal very soon, and happy holidays, everyone. Take care. Good night.